For me, Alzheimer's is very personal. My mother passed away from Alzheimer's a little over 2 years ago. My mother-in-law passed away from early onset Alzheimer's.
One day, you're vibrant and wonderful and have the whole world ahead of you, and the next morning you wake up and you say, uh-oh, something's not right. I remember that happening to my father.
My dad had to go into a nursing home. It was very difficult. I brought my children to visit him. We had nice visits. He kind of knew who we were.
I was really close with my maternal grandmother. It was really devastating for somebody that taught me so many things in life that toward the end, she didn't even know who we were.
In my mother's case, she was a college professor and an established artist, a woman who spoke 6 languages fluently. There's no one who can prepare you for this journey to watch someone you love basically fade before your eyes.
Every story is different but the same. The loss of somebody that was dear to us, the person's there, but they're not there.
I love my mother. And here's a woman who had such light in her eyes and power. She knew something was wrong. My late wife, Evelyn, came in to see her in her home one afternoon and said, "Esty, we miss you in the office." She turned to her and answered her, "I miss me too." What that did for me and for my brother Ronald, it energized us to say, okay, we have to fight this disease and we have to do everything we can to prevent it.
Leonard and Ronald Lauder founded the ADDF because of their own mother's experience with Alzheimer's. The genius of what they have done is to have had the vision to bring together the top scientific talent in the world and then partnering with drug companies and the community most affected by Alzheimer's.
They brought their idea that we should solve this through a very innovative model called venture philanthropy, in which we should be funding things that have the potential to pay off and give us returns so that we can fund other ideas.
When ADDF started about 25 years ago, it was 1998. We had accumulated some knowledge about the disease, but there were basically only 1 or 2 drugs on the market at that time, and they were not very effective. This is a chronic, progressive, uniformly fatal neurodegenerative illness of the human mind. It robs people of their humanity.
Dr. Howard Fillett, who was our scientific director, came up with using an amyloid PET scan and a blood test, both of which gave you a positive diagnosis. Then you could work on trying to cure it or prevent it.
And through the Diagnostics Accelerator and other partners like Bill Gates, Jeff Bezos, Mackenzie Scott, the Dolby family, as well as the Lauders, we are putting $100 million towards new biomarkers. That is paving the way for interesting results in new therapeutics.
We're developing biomarkers to identify people that have amyloid in the brain, people that have other biomarkers of Alzheimer's like the tangles, inflammation, genetic markers, and tailor medications against those pathways, translating the biology of aging into new therapeutics to stop Alzheimer's in its tracks.
The ADDF recognizes that there is an underlying biology, and to make major advances, we need to target that underlying biology. There might not be a lot of support for something that hasn't been proven over and over and over again, but that's not innovative. Innovative is discovering something new and developing a plan to attack it. Everything from discovery in the lab to early stage clinical trials, wearable devices, healthy aging interventions.
That's why I'm so excited right now, because this is harvest time. It's time to harvest all of this knowledge. Tens of thousands of research reports. We've got 120 drugs in clinical trials right now for Alzheimer's disease. That's amazing.
Technology is allowing us to map the brain at a resolution that we've never done before. If you think of Google Maps, you see a city and you can zoom in to street level view. And that's what we're doing now with the brain. Not only see the houses, but open the door in those houses and take a step in so we're able to really understand what is happening deep inside how that cell works, and then map it.
The adversity of Alzheimer's has brought out the best of humanity in all of us. That's what I see at the ADDF.
It's a really diverse group of people from different backgrounds and different professions, but are really united along the mission of ending Alzheimer's.
When you look back over the last 25 years and see just how far we've come, it's astonishing. Here we have a community of scientists and doctors and donors to fight this horrible disease. And for the first time, there truly is hope.
Any academic success that you might have, that is not why I do what I do. It is because there are people with this disease that need hope, and hope is here.
Hope is here. Believe me, hope is here.